Welcome back. On health, we have Dr. Olalekan Ojo, a consultant nephrologist with Federal Medical Center, Owo, Ondo State, and former NMA president, Ondo State. And today, we're talking about kidney disease. Of course, it keeps increasing in this part of the world, and we'll be talking about kidney complications arising from diabetes disease. It's great to have you, doctor. You're welcome, sir.
Good morning. Thank you very much. Sorry, please, I have to correct something.
Okay.
I was never NMA president.
Okay.
I was the chairman of the Medical and Dental Consultants.
Thank you
Federal
very
Medical
much
Center.
for pointing that out. Thank you very much, Mr. Chairman. Yeah. All right. So, kidney diabetes and kidney-related complications. Now, let's start with the prevalence rate of diabetes as it is now. What is the present prevalence rate of diabetes?
As far as this country is concerned, the endocrinologist will give us that data.
Okay.
But what we know is that there has been an increasing trend. Because I think in 1967, Professor Akin-Kugbe and his team did a survey of diabetes in the country, and at that time it was perceived to be low. Less than 1%, but as at 2007, it has risen to over 3%, and the trend has increased.
Has increased?
Yeah, so we have an increasing trend of diabetes.
What causes it? Is it our lifestyle? Is it our food? What is happening?
Well,
why that increasing rate?
Well, of course, it's a mixture of two things. We have individuals who have a genetic load. Maybe parents are diabetic, and meaning that if they are exposed to a lifestyle that can make them to come up or come down with the disease earlier. So we have individuals who have that, and then some other situations that we don't know anything about. Yeah.
So how does diabetes affect the kidney?
Well, the impact of diabetes on the kidney is at different levels. Number one, you know that diabetes mellitus impacts virtually all the systems of the body, the brain, the eye, the kidney, the heart, the nervous system, the cardiovascular system, and everything like that. So, and then it also affects the immune system. So, a diabetic ordinarily will come down with infections more than a non-diabetic individual, especially a diabetic who does not attend to his care sufficiently. Now, talking about the kidney specifically, some of the long-term complications of diabetes mellitus is that they affect the smaller vessels. So we label this the microvessels, microvascular complications. When diabetes mellitus has been in the system for long, the small vessels get affected. So you now have manifestations in the kidney, the nervous system, and the retina. So, and that is why when an individual has diabetes mellitus, by the time we're seeing some things in the urine, as a nephrologist, if an individual comes to the clinic, one of the things we ask them to do is we want to look at the urine. Okay. There are specific things we want to see. Ordinarily, the urine should be free of sugar and protein. And then even for the protein, we have the large molecule protein, we have the smaller ones like what we call the albumin. Now, with time, an individual can first develop or we can detect albumin in the urine. At this point, we can still do something, we can reverse it. And then, of course, it can go on to having overt or gross protein in the urine, by which time we begin to see some deterioration in the kidney function. There's a way we assess the kidney function of individuals. And then with time, it goes on to impacting majorly on the function of the kidney, because the kidney subserve both the excretory function and some other functions like integrity of the bone, production of red blood cells. So with further deterioration, you have reduction in red cell formation. You have, of course, meaning that this individual will now be having low blood level, what we call anemia, and an anemic individual has less energy to do some other things. And with time, the individual might go into what we call the kidney failure that will be requiring dialysis, either hemodialysis or peritoneal dialysis, and ultimately kidney transplantation. So it's a spectrum. And usually an individual whose kidneys are affected will have other things affected. So by the time somebody is peeing much protein in the urine, the ophthalmologist looks into the eye and begins to see changes attributable to diabetes mellitus, and then begin to have some other nervous, that is involvement of the nervous system. So the individual has some abnormality of sensation, maybe working on cutting wool and a few other things like that. So all these things, yeah, the kidney is seriously impacted, and then it affects the life of such an individual.
Wow, now this is also much taken at the same time. How can one reduce the susceptibility of, his own or personal self to this disease?
Deterioration. Okay. Well, it is good to know yourself. When I say know yourself medically, a number of us don't even know the conditions that our parents are battling with. About a week ago, I saw a young man, less than 40, coming down with diabetes. And in interacting with him, he said the grandfather was diabetic, the father was diabetic, and unfortunately, he was just taking all these fizzy things. At 37, he has come down with diabetes.
Fizzy things? What do you mean by fizzy things?
I'm talking about carbonated drinks, soda, Pepsi Cola, Coca-Cola, 7-Up, and everything like that. I mean, this guy told me he was taking it every day. So at 37, he has come down with diabetes. Meaning that if we're going to project, if he doesn't take good care of himself, he's a candidate for renal disease. So you know yourself. Do you have the burden? Then you need to take care early in life. Now, even if you assume you don't have the burden, we don't eat healthy as our foreparents used to. So we need
They were more natural, but we have a lot of processed
Exactly.
food.
And then we generate a lot of free radical, belaboring the pancreas and the other organs excessively. So we need to eat healthy. We need to exercise. I mean, in this part of the globe, in fact, a singer sometimes said it is the man that has the pot belly that you keep your money with, not the one that is asthenic, as it were. So we need to do all of these things. And then if for any reason now, you know that you are diabetic, because, I mean, I saw a guy, a 40-year-old who resides both in the US and in Nigeria, that I said, look, when last did you see a doctor? He said, I know, I've never been ill all my life. Then I asked him, because he drives a limo. I said, when last did you take your car to the mechanic? Was it when the engine knocked? I said, no, I go frequently. Now, it's such an irony that individuals will take their car to the mechanic without any complaint at all, but we don't check ourselves. So you do a regular check of yourself. What is your blood pressure? What is your urine like? What is your sugar like? Now, when you know all these things, if for any reason you are diagnosed as being diabetic, then you need to listen to your doctor. Because the other thing in this part of the globe, again, is that we have people that are so knowledgeable. They will tell you this one works and everything. And by the time they are coming to us, I mean, the case is almost irredeemable.
Doctor, this is eye-opening. It's not like, it's enlightening. Thank you very much. I hope you can still come back. Because left to us now, I will sit down with you for hours and hours and continue talking. But thank you very much for today. I hope we can still continue this.